Hi, this is video one where I'm going to talk about the symptoms that led up to me having the surgery. As you can see, I've already had the surgery, but before I had the surgery, I went onto YouTube and I did find some really useful videos that helped ease my mind about going in to have the surgery. I just want to talk about some things that I did that led up to me having the surgery. This will be video one. So I had had neck pain for probably 3 to 5 years prior to this surgery. I fell off a horse when I was in college. I was probably 19 years old. I also I was riding a moped on a dirt road and I crashed the moped. I landed on my chin. I had fallen skiing and really had like a whiplash injury. So I kind of had a bunch of different things that had happened that I think accumulated to that part of my neck really getting worn out. And the doctors said that it looked like I had had a bunch of fun because my neck looked really old at the C566 level. But I still want to have more fun. So I started having nerve pain going down my left arm in October 2015. Now, this really freaked me out because I'm an occupational therapist and I knew that nerve pain down your arm coming from your neck is not good and you need to get that treated. So I was going to the chiropractor and they started me on the Spine Med decompression table. I probably did 40 or 50 of those total. I was going 3 times a week and it does a slow traction and I was getting a lot of good symptom relief. Things were going good, but when I would lay off of the traction, say over the weekend or 4 days, not having it, then my symptoms would increase and I'd start to have more pain. So I went through all of that. I was being adjusted regularly. And then I went through their exercise program, but then I still just was not completely better. I knew that the nerve pain was coming from my neck and I was still continuing to have that. I did have an MRI in December 2015 and the results did show that I had herniation at C5C6. I had some Tarlov cyst through my neck and upper thoracic area, but that was something that if it's not symptomatic, they don't really do anything for that. To me, the MRI looked kind of scary, but I continued with my treatment and started seeing a different chiropractor who did some different adjustments. And I had periods where I would have like basically no nerve pain. The chiropractor I was seeing also did acupuncture. When my nerve would flare up, the acupuncture worked like you wouldn't believe. I mean, it really helped relieve the symptoms going down my left arm. But all of these things weren't really lasting like I was hoping that they would. We were trying to avoid surgery, so I was doing all the conservative treatments I could. I had a home traction unit. It's pretty freaky looking, but you put it around your neck and you inflate it, and that thing really helped relieve my pain, especially at the end of the day when I could get that traction and give myself some increased disc space. That really helped. And I also used ice like you wouldn't believe. I mean, I would put ice on my neck, and that seemed to be the only thing that could relieve it, that and the traction. And then the adjustments and the acupuncture were really helping. Well, then I started physical therapy. I'm an OT, and I know a really good physical therapist here in town. So I started PT in November of 2016. And we started doing dry needling. She was doing dry needling on me, and I was doing an exercise program. Now, what happened was from October 2015, when the nerve pain started, up until February 24th, 2017, what happened was my symptoms would get better and then they would get worse. They'd get better and then they'd get worse. So then I had a new MRI done January 2017, and that showed that the disc herniation was better, but at C5C6, they said it was desiccated, meaning that the disc was drying up, dehydrated, and starting to break off. I decided to see a neurosurgeon. When he saw the MRI, he said that based on the MRI from 2015, December 2015, he actually would have operated on me then. This is based on his experience. I had quite a bit of disc degeneration at the C5C6 level. I was having the radiculopathy, the nerve pain going down the left arm, and the pain was not being relieved for a significant amount of time. It would be relieved and would come back. But the big thing also is that in the foramen, which is the opening where the nerve roots come out, I had quite a bit of compression there because of the bone spur. The bone spurs were continuing to grow in that area, and that was not allowing enough room for the nerve roots to come down. And so basically I started getting worse. I started progressively getting worse. The worst things were trying to sit. I could not sit to drive without having a bunch of pain. I would have to sit kind of cockeyed and really get in a position. I couldn't sit, like when I would go to Sunday school and church, I could not sit upright in a chair. I needed to be reclined so I could get the pressure off of the nerves. And that's kind of what led to me saying, okay, I'm going to go to this surgeon. I'm going to get some advice. He came highly recommended. He did surgery on a friend of mine, and he saw my physical therapist, and he did not recommend surgery, so he wasn't surgery happy. And he also did back surgery on my chiropractor's wife, so I knew I could trust this guy. And he said, I would have done surgery. I hope you don't have permanent nerve damage because we need to get in there and do surgery. So before the surgery, 7 days before the surgery, I had to quit taking Mobic and Aleve. I refused to take narcotics because I wanted to feel it. If my neck was getting worse, I wanted to know if it was getting worse. And I was, so the treatments that I had prior to the surgery were, I had chiropractic treatment, acupuncture, physical therapy for 4 months, dry needling, traction, ice, heat. I also had an epidural injection where they went in through the back of my neck, and then I had a second epidural injection where they went right into the foramen on the side, on the left side of my neck. And both of the injections, within 2 days, my symptoms returned. So seeing the neurosurgeon, he let me know that really there didn't seem like there was anything else they could do other than surgery. So those are the symptoms I had prior to surgery, which led up to me having a C5, C6 anterior discectomy where they scraped out all the bone spurs and they fused my neck. And the next video, I'll talk about something different. Okay.